Good day, everyone, and thank you for joining our sessions today. Mental health is a growing concern. Good mental health is essential. Considering that we spend 1/3 of our time at work, and knowing work stressor were among factors associated with poor mental health, with no surprise, addressing mental health and well-being is a key priority on Singapore's national agenda. How do we ensure a good well-being environment in workplace? On November 20th, 2023, the government issued the second edition of the Tripartite Advisory on Mental Health and Wellbeing at Workplace. This advisory contains several recommendations. This recommendation includes conducting survey to understand the current work environment, reviewing company HR policy and suggestions, initiative to improve awareness from management to employee. It is crucial that we take these recommendations seriously to create a healthier and more supportive work environment for all. My name is Joanne. I am the VP of Account Management at Workplace Options. As a people leader and who speak to many clients, we often ask ourselves, what can we do to improve employees' mental health, and how could we improve their knowledge and be more aware and self-aware of their and others' mental health state? I'm excited to share that we have two speakers joining us today to share their experience and suggestions based on what we can do in workplace to support employee well-being based on this advisory. First, we are honored to welcome Dr. Gerard Ng, a consultant and expert working with Fullerton Health Group, an experienced psychiatrist who was educated at the National University of Singapore and Harvard University. He has a rich background in psychiatry and public health, and his experience includes servicing as military psychiatry with development for disaster relief, humanitarian aid missions. Dr. Ng was a consultant overseeing the child and adolescent inpatient unit at the Institute of Mental Health, IMH, and was founding chief of department of emergency crisis care at IMH. His extensive clinical experience provides him with a great understanding of workplace mental health, allowing him to effectively help individuals navigate professional challenges tied to mental health. Dr. Ng is also a dedicated educator and volunteer, contributing significantly to mental health advocacy and community service. He is committed to creating a mentally healthier future for all. Oliver Brett, General Manager and Vice President of Enterprise Solutions and Workplace Options. Oliver's journey began with a psychology degree with honor at University of South Australia, followed by a Master in Professional Psychology at University of Wollongong. Throughout his career, Oliver has been dedicated to major culture enhancement, team development, and leadership development, working with numerous high-profile organizations and individuals across the world. His wealth of experience enabled him to provide comprehensive enterprise solutions that align with clients' company strategic objectives. Before we start with the questions, I want to ensure we have an effective learning experience. We encourage you input your thought throughout the question panel on the right-hand side, as well as responding to our live poll will pop up on your screen. Let's get started. Mental health costs run steep. Lost productivity and absenteeism due to anxiety and depressions are estimated to cost the Singaporean economy nearly Singapore dollars 15.7 billion. Dr. Ng, how do you recommend organizations address the well-being needs of their employees?
Yeah, thanks, Joanne. Thanks for the kind introduction. And I'm really happy and honored to be here to share some of my thoughts and experiences. I work in mental health for more than 2 decades, and I've been working in the private sector for the last 1 year, almost 1 year exactly. I must say that seeing patients across the different age group, especially the working adults, is really, really important then for companies to really promote a supportive work environment. I think one where employees are able to speak openly about their mental health issue without fear of stigma or without concerns or retribution, I think that is really crucial as well. Mental wellness has been in the news a lot, especially during the COVID-19 pandemic. A lot of companies started paying a lot of attention to mental health, and I'm glad that many of these companies are not just paying lip service. In order to promote a supportive work environment, like what I said earlier, I think there's also a need then for companies to have training for persons in managerial roles, training for the leadership on how to recognize signs of mental health problems, and then how to respond appropriately. I do think that a lot of companies also now start to implement EAPs, employee assistance program, to help them. I think that's a very good start. But what happens after that if patients or persons require more assessment and more attention? Is there enough resources and coverage for them to see a psychologist or see a therapist? Because we know that the earlier we intervene, the easier is it clinically, and the more that we can save in terms of productivity costs lah. So I think that is something which companies can do, not just have an EAP, but what's beyond the EAP as well. Yeah.
Thank you for sharing, Dr. Ng. Yes, definitely. Those are very important points. Oliver, what other suggestion do you have for addressing the well-being needs of employees?
I would absolutely agree in that it's really important that organisations have those support programs in place. We know that as people attend work, there are some terrific outcomes from engaging in employment, in regards to remuneration and being paid to be able to support your family, good sense of self-worth. But what can come with that as well, though, is an element of stress and exposure to some potentially distressing experiences, due dates, if your job requires you to support other people or engage with distressing material, if you're in cybersecurity, for example. These can all be things that can add to someone's stress or distress. So naturally, participating in work is going to at times mean that your people's well-being is compromised or is challenged. So ensuring you've got programs such as EAPs and other holistic support programs is really important as well. What I would also say there is it's important for organizations to understand the psychological risk profile of your organization. So this is looking at some of the duties that your people do, as well as some of the presenting issues that you might be seeing within your EAP reports each quarter or each year as well. So in regards to the psychological risk profile with the job duties, having a look and understanding about what strains or distress might be present for people in that area. Is it long hours? Is it isolation? Is it noisy environment? Is it distressing materials? And making sure you've got programs and things built into the way that work and jobs are designed to give people a break or a reprieve from that or support around that. And then also, it's great to have an EAP, but to build on Dr. Ng's reporting there as well is once you have these programs in place, make sure you're then reviewing what's coming out in the presentations as well. Are lots of people presenting for stress? Are lots of people presenting for burnout, interpersonal disagreements or friction? And seeing then what you can do to really tailor training programs or additional support programs to support your people.
Thank you, Oliver. Yeah, those are very, very good pointers. And there's a lot of points that we will definitely speak more in details in terms of the benefits. I hear like training, EAP, leadership, supports, etc. So moving on, we have some poll questions for the audience. Please choose the answer you see on the screen that resonate to you. In your organizations, does well-being matter to leadership and employee? Please select one, yes or no. So do you know nearly 87% of employees do not seek support for mental health issue due to the stigma associated with it in Singapore? Just like earlier, Dr. and Oliver has mentioned, with all the implementations of training, acknowledgement, this is important, having EAP in place, but there are still challenges within the environments, the social environments, the work environments that prevent people to seek for support. Despite efforts to raise awareness and provide educations to reduce mental health stigma, it remains a challenge. I can see that most of you have answered that well-being does matter to leadership and employee. So going back to Dr. Ng, based on your experience, what are some effective initiatives organizations can take to destigmatize mental health in the workplace? I mean, one of the suggestions in the advisory is you mentioned that to appoint workplace mental health wellbeing champions. How can champion be leveraged to break down, pre-existing stigma and normalize mental health?
Okay, thanks, Joanne. I think there's a lot of talk about companies having this wellness champion or wellness ambassador, as they called it. And even in the hospitals that I worked in before, I think there was also a move to encourage even the employment of patients within the hospital itself to sort of be the champion for wellness. I think this is important. I think it shows a visible commitment from the leadership of the company to support all these mental health initiatives. But if we want to focus on well-being ambassador, I do think that the right person is important. Can you imagine if the well-being ambassador is someone who is really not a people person, or is someone who has got other roles in the company that may be a little bit more disciplinary in nature, and they wouldn't be sort of credible in providing this well-being ambassador. Or for example, this person is not a role model. He's someone who sends out emails at 4 a.m. asking work to be done. So this is really the wrong person to become a wellness ambassador. I think the selection of the ambassador needs to be important. I do think that the company, maybe starting from the leadership, needs to create this environment where workers can have an open dialogue and have a conversation where they feel safe to discuss mental health distress and mental health issues that's not necessarily related to the workplace. I think Oliver mentioned that a little bit, that a lot of the workers that we see don't just have problems at work, they have problems at home also. Can then work be an environment for them to openly share their distress? A lot of times people may believe that issues at home shouldn't be brought to work, but we are human beings. We cannot compartmentalize ourselves that way. One tool that I think is very powerful is actually sharing stories. I think the stories that is shared need to be genuine, especially if they are sharing personal experience with mental health. I went to a town hall where the CEO of a company was trying to share about his own experience with depression. But eventually, I think he was trying to be nice, but the story that he was trying to be safe. But the story he shared was how he became very depressed after he didn't get all A's for his exam. And I think that sort of trivialized the entire platform. And I think you can see some of the employees rolling their eyes. I think they need to read the room as well. Of course, I'm not saying that someone who don't get A's for exam cannot be depressed. They can. But I think at that platform, I think in a bit that he tried to bring himself to the ground, I think it totally achieved the other effect, that people think that this guy trivialized depressive conditions. So I think a genuine storytelling would be really, really important. And I think companies should also then ensure that there is confidentiality. Otherwise, if the workers know that this well-being ambassador is just going to report everything back to the senior management, they're really not going to share anything. So this is my view, some of the ways that a well-being ambassador can help.
Thank you, Gerard. Thank you. Yeah, quite a few pointers, and important pointer to take note as well when appointing a well-being champion. The right people to choose from, the good storytelling, the knowledge of people knowing mental health awareness before they start sharing the story. How do we support those well-being champions after they've been selected, and how do we train them? Oliver, I think this is one of the expertise that you are in right now. Can you help us understand a little bit more? I mean, of course, starting with the stigma, for example, and then moving on, how do we actually, have the entire selections of the well-being champions and, any trainings that will benefit them?
Yeah, thank you. So to dive a little bit deeper into stigma, the way we view stigma, or the way, at workplace options is it occurs across 3 different dynamics. So, and these are all really relevant to an organization, but the first level is societal. So what is the level of acceptance of the mental health conversation and acceptance of mental health illnesses, disorders, and well-being as part of what humans experience in living as well within the communities and society in which your organization operates? There's also then the second level of stigma, which is what's the perception of mental health well-being within the organisation itself? Is the culture one that accepts that people will experience challenges and wants to support them through it? Or is it a culture that dismisses it and sees it purely as an interruption to productivity or something that only the weak experience? And then finally, you have individual stigma as well, which is what we ourselves as individuals tell ourselves about the acceptance of mental well-being distress or strong mental well-being, or what contributes to our mental well-being and how much we prioritize that as well. So there's not a tremendous amount that organizations can do for societal stigma related to mental well-being, other than to be a good bastion or a good advocate for strong mental health and be one that supports good mental health and prioritizes that for its people as well. But that mostly sits within that organizational stigma level. And this is where organizations can really have a good influence over the mental health narrative as well for its people. So is the organization putting in programs and speaking positively about programs such as EAP and other wellbeing programs to support people utilizing it when necessary? Is the organizations doing things like investing in an ambassador program so that it can have people that are at the front line with people that are trained to have conversations that then link back to those other support programs as well? And is the leadership and management of the organization also advocating for and literate in the mental health conversation as well? So in that poll before, we saw that 98% of participants here in our webinar today say that their organization's leadership and employees value well-being as a concept and as a priority for the organization. That's really good. That says that we've got good awareness. But does the organization understand, and does its managers and leaders understand their role in then translating that awareness into an active part of the organization's culture and operations, whereby it is advocating for people to balance their well-being with their workload, to seek support when they need it, and to also speak positively and encouraging others to access support when needed as well. Now, with individual stigma, you know, that's the role that organizations can play there to support people to perhaps increase their own mental health literacy and acceptance of their mental well-being, and that it's an important part of how they approach each day and each week, is to, again, be a good role model in regards to prioritizing the conversation about mental being, offering trainings, offering education pieces for people as well, to again demonstrate that this concept in this conversation is not something to be scared of, but something we want you to encourage to learn more about, to better support yourself, as a family member as well, or a society member, community member as well. So that's the three levels of stigma that organizations are operating against. And you really want to be making sure that your organizational culture is hitting that second level, and that you're also not just doing things on Mental Health Day or Mental Health Week, but day to day, how is your organization talking about mental health to then support individuals to look after their own mental well-being as well. When we get at ambassador programs, I 100% agree as well. You need to have the right people in the right positions. And I always advocate for those individuals to not just be people in leadership or management positions, but also individuals that your workforce would consider colleagues, so they're peers. Now, that's really important because it takes away some of the power imbalance that can be an inhibitor or a concern for people to open up if the ambassador is their manager. It can be another level of hesitation that people have, thinking, well, if I'm about to open up to this individual about the struggles that I'm having at home or at work, but they're also my manager, how are they going to perceive this? How are they going to perceive my competency and capability to complete my tasks if I'm opening up to that individual versus, say, a peer or a colleague that we're on the same level with? So I always advocate that it's good for organizations to really get their, if they are to input a ambassador program, that they look to have individuals at leadership, management and peer level to really get it embedded into the organization. Secondly, be really coherent and understanding in what the role of these ambassadors are within your organization as well. And a really good ambassador program is one that defines these individuals as being the linkages between the wellbeing programs that you have and your people. They are advocates. They are people that don't know how to have a clinical conversation. They're not there to do any sort of intervention or counselling. They are there to normalise the conversation about mental well-being, to advocate and reduce that individual level stigma, and then link your people to those wellbeing programs so you get high utilisation, higher support, and everyone gets back to performing some really good work for your people as well. And then thirdly on that is, if that is, as I would suggest, being the main impetus or the main focus of your ambassador program, then you need to be making sure you pick one that educates, and the content of its education program speaks to that. So it speaks to some of the main mental health challenges that people will experience as a result of work, or they might experience the normative at home, but then bring to work with them. People probably don't need to be really understanding about severe mental disorders like schizophrenia or bipolar, etc. Your ambassador program should be educated on, what does low mood look like? What does stress look like? What does anxiousness look like? And how it can then support people to link into those programs. And finally, because I know I've been talking for way too long now, Joanne, is also making sure your program has support for your ambassadors as well. You can't just release these ambassadors out into your organization and expect them to go do a job, stay committed to their role as an ambassador, and also for them to be all right. It can be a heavy job listening to other people's concerns. So make sure you've got a robust support program, maybe a peer support program or a professional development program that wraps around your ambassadors to help them stay engaged in their role. There's no point training these people if they don't then carry on and actually fulfill the ambassador role, but then also one that supports their well-being as well, so they can be out there and be good role models, good advocates for mental well-being and for the ambassador program.
Thank you so much, Oliver. No, you're not taking too much. I think that is excellent insight. I mean, that's definitely coincides with what Gerard has mentioned. You know, it's good initiative, but how do you actually have the right people? Then when you have the right people, how do you make sure they know the roles and responsibility? And they are not trained psychologists, so they are not supposed to take on the burden. So how do they then, you know, get support afterwards and constantly getting educated and wellness? Also, you mentioned something very important is when managers and leaders are being selected and as a well-being ambassador, they also have a dual role that is challenging to make sure, you know, when personal issues are being shared.
Creates that power imbalance, yeah.
Correct. So those are excellent insights that thank you so much for sharing. So of course, those are important, but as we go deeper to this topic, you also talked a little bit about culture. We understand that cultivating a healthy work culture is very important. The cause of work stress can be contributed both work content and work context. So work contents include elements such as job scope, workload, and work schedule, which, you know, those you can talk to your manager. Those are quite obvious that you can see. But while work context refer to organizational culture and daily interactions at work. So it's important to recognize that all of these factors can significantly impact employee mental health. So going to talking about culture, Dr. Ng, from your experience, what are some common challenges in creating a culture of well-being work environment?
I think this is really a very complex issue to handle. I think most companies grapple with it, including healthcare organizations, right? I think it's pretty easy to say that the company is paying a lot of attention to mental wellness, but when it comes down to the nuts and bolts, I think it's a little bit difficult. We all know that people are resistant to change and new initiative. Different people from different age groups will react differently to change. I was having some meetings with some of my friends, and the complaint that they have was about the Gen Z employees. I hear my ex-colleagues from the hospital talking to me about having to cope with the new Gen Z doctors who come into the organization. So I think we have to look at how the diverse needs of different employees. Every different age group have got different needs, different preferences. And I think companies sometimes may find it quite challenging to design programs, even mental health programs that cater to everyone. I've heard people talk about how if we cater too much to mental wellness, will it affect resilience of the young people and so on and so forth. So I think the companies do need to look at the different profiles of the employee they have and then see whether they could tailor make the programs accordingly. I think the other challenge which organizations may have actually would be about resource. This is really by no means a criticism of the company. I think money is short, time is short, and sometimes they may find it very difficult to dedicate time to well-being activities because work is just so busy, right? All of us are busy. What more a big company? Budget is one. I think in especially in in public practice, I think I don't hear so much of it. I think in private practice, I do hear about different companies, different insurance have got different coverage, and really that affects the level of help that is accessible to the workers. I hear of some companies who say that employees can only get help in the public healthcare systems in Singapore. I've heard that because they don't trust the private practitioner. I think it's all well and good. They could go to a public hospital for help, for treatment, but then the waiting time is 4 to 6 months for your first appointment. I think we have to be realistic that some mental health issues cannot take 4 to 6 months. And the only alternative is either they go to the emergency service, where it's a different set of problems, or if they go to a private practitioner, which then costs a little bit more money. I think resource constraint would be another challenge. I think we spoke a little bit, Oliver spoke a lot about stigma and how it can be generated by lack of awareness and training. I think this is also a barrier. I think most employers, most senior management, they have a good heart. They do want to do what's right by their workers, but they don't know how to. And they don't know where to get the proper training and education. I think that's where EAP providers will be helpful. That's where linking up with mental health professionals may be helpful so that we could equip them with the right level of skills. We're not training management, or we're not training the well-being ambassadors to be specialists in counseling or psychology, but we are training them on how to recognize the signs of mental health conditions and also how to appropriately respond and when to escalate the case. I think this is important. I think people skills is important, active listening skills are important, and maybe that's where managers can also be trained to get the necessary knowledge and skills needed. And I think finally, we also cannot, another barrier is that sometimes some of the policies that pertains to mental wellness really are not health policies. Things like harassment policy, things like confidentiality clauses. I think these are also important things which companies need to look into, because imagine if someone is harassed in the office and there's no good governance or no good policy surrounding harassment. You see how this can affect the mental health of not just the employee, but also everyone else who sees the issue and then nothing is done about it. And everyone's mental health will be affected. And confidentiality is really a no-brainer. I think in this day and age, maybe because of stigma, maybe because of misconception, a lot of employees are not willing to let the employers know about their mental health concern or even the fact that they are seeing a psychiatrist. I have got patients asking me to erase the name of my clinic from my MC or to remove the word from my MC that I'm a psychiatrist. Because they are scared that if the employers find out, it will affect their career progression, it will affect their job. They think that there will be bias against. So confidentiality issue is a big thing, which I think is a significant barrier that companies need to overcome as well.
Thank you. Thank you, Dr. Ng. Oliver, do you have anything you would like to add? I think those are very good points. I mean, talking about the last point, sorry, I think looking at different perspectives, people are actually willing to help to get better rather than being, seeing against that you have this challenge. It's totally different now. I think those are good encouragement that it is okay that you're actually asking for help and want to be better in your life.
Yeah, no, I think that was some tremendous information, insights provided there. And I think it's an absolute reality that organizations do have finite resources for well-being. It's got to be one part of what an organization invests in the way it does business. You've got to pay wages, buy materials, rent, licenses, insurances, all sorts of different things. So the reality is that organisations have a finite amount of finance and time to be committing to wellbeing. And I think that's something that us as healthcare providers and wellbeing supporters need to work with, not fight against, and make sure that we're creating programs and marketing programs that fit within that. And I think it's therefore really important for employers to really be making sure that the wellbeing architecture or the wellbeing programs that they're putting together for their people are truly effective. So they're provided by trusted providers, and they are in the areas that are of most meaning and purpose to their people, and that constitute good value for them as well. And we've been doing some conference speaking here in Australia lately from some data that's been collected on workplace trends. And one thing that's really important for employers to recognise, though, is that there is what's called an executive blind spot. So how your executives and leaders view the organisation, the stressors within the organisation, is very different to how your frontline employees experience their daily work. So I would be encouraging organisations, in order to get best value from your time and finance resource investment, to be going out there and trying to create a confidential pathway for your people to provide you their insights. What are they finding challenging at work? What are they finding is challenging their sense of well-being? Of course, the concept of confidentiality is a barrier to that, and organisations need to be really thoughtful in how they do this to help people feel confident in providing their insights. But through gathering your employees' perspective, you can avoid that executive blind spot and really identify the needs areas for your people, and then invest in the programs that are going to really support them in doing that as well. The other thing that I'd comment on in regards to creating that wellbeing culture, and Dr. Ung, you referenced it before with that leader that spoke about their perception of mental health, their experience of mental health. And again, that may very well be true, but it sort of fell a bit short of the mark with their people, is going out there for one day a week or one day a year or 1 week a year where you have a mental health or wellbeing campaign, and you advocate for it with your employees, and leadership and management say, yes, we're all going to support each other through this journey. If you then the next week return back to being non-supportive about mental health, not accepting people's stories, not supporting people for work-life balance, etc., your employees are going to see straight through that, and you're going to end up in a worse position than when you started for. So I really think that I strongly encourage all organisations to take wellbeing seriously, because it has been found repeatedly through the data that it's a great business case for it, as well as being a good human thing to do. But when you're going to do it properly. And remember that it's not just having those days or weeks where you advocate for mental health, but realizing that your people are going to look to your managers and leaders every single day for influence, for guidance, for perspective and understanding about the culture of the organization. So making sure that you're 24 hours, 7 days a week, supporting and advocating for wellbeing within your organization, not just when the spotlight is on it. And if you can do that, you'll build confidence within your employees about what you're trying to achieve in the concept of wellbeing. People will feel safer in these conversations, because you're not on one day saying, yes, we all want to be talking and healthy, and then the next day saying, oh, I don't want to give that person any work, they've got mental health issues. If you're more coherent and aligned in that, people will start to trust you as the manager, you as leader, the organisation as a whole. Stigma will start to come down, and you'll start to see more buy into these programs, and then you'll get the real outcomes and impacts. And that's how you create a culture of wellbeing.
Yes, thank you, Oliver. I mean, there's a lot of pointers here, and it can sound like culture change could be difficult, but it's definitely not impossible. We can definitely change workplace conditions to create an environment in which employees can feel safe, and that's where they can thrive in work, definitely. Moving on, going to share some heartbreaking, statistic that there is actually being a concerning rise in the number of suicides in Singapore, actually. In the 2022, there was an increase of almost 26%, which is about 476 reported cases, making the highest rate in over 2 decades. This reflects the unseen mental distress in the city-state, according to the local non-governmental organization. This is definitely concerning and heartbreaking. In the workplace, we also already spoken how important the leadership is supporting these ideas and creating a mental health, healthy work environment is important. And it's very, very crucial. So Dr. Ng, could you please provide more details on the steps that senior leadership can take to effectively respond to warning signs of mental distress and engage in dialogue with employees about their well-being? For example, one of the stories you shared earlier, what more can they do in the organizations?
Okay, I think at this point, maybe Oliver and myself, we feel like broken recorders. We're always talking about mental health training and maybe building more awareness for the companies, not just the senior leaders, but this should permeate through the entire organization. I think part of mental health training is always going to be about recognizing the signs and symptoms of mental health distress, and then where are the different avenues of help available. It could be EAP, it could be polyclinics, it could be psychiatrists, it could even be members of the police, right? Because of how urgent some mental health crises are. I think just now Joanne introduced me that I founded the Department of Emergency and Crisis Care at the Institute of Mental Health. And to me, in my previous life, my previous job, mental health crisis could be a suicidal crisis, or it could be a homicidal crisis. I think these are two things that we are always very concerned about. So training is one thing. I think the other thing, which again we cannot overemphasize enough, is the need to create a supportive environment. I had the opportunity to talk to one of the senior management of a company after one of his workers committed suicide. And when I talked to him, he said that he was not aware that the worker was going through so much marital troubles and financial issues at home. Work has always been okay. So I think after that he created this open communication. It was another company, not the original one I spoke about, right? Where he had open dialogues. He went around, like what Oliver said, he went around onto the ground to talk to employees, to let them feel that it is very safe to express their concerns. And the concerns is not just about work-related concern. The concern is also about whether they face any problems at home, whether there's anyone in the company that can help out. I think he also inculcated a culture within the workplace to promote the fact that you should watch out for one another. If you notice that one of your colleagues or one of your friends at the workplace looking as though they are going through something difficult or having a change of behavior, reach out to them, and then different ones of them will go through different courses and workshops on how to reach out to people, how to talk to people. And in the end, the culture of the company changed after about a year or two. It takes time. It's not going to change immediately. So I think this is really quite important, and you can implement regular check-in. I suppose you can use survey and feedback. I think those are really quite useful. There's a place for them. And be prepared to get bad replies, bad feedback results, bad survey results. And then you use that data to identify the trends in the company and the areas that improvement. I think the other things which senior leadership can do, since you asked about them, is that they need to be role models. They need to lead by example. Before IMH, I used to be from the armed forces. And I think leading by example is something important. Imagine if you are someone who goes around saying that we need to promote work-life balance, and you send an email at 2 a.m. or you reply to an email at 2, 3 a.m. That may not be leading by example. I think this is something which leaders should do to model healthy behaviors, taking mental health days off, taking regular breaks. I think these are all things which senior leadership can do. Yeah.
Thank you, Dr. Oliver, I mean, we've been repeating a lot of few points the last 10, 15 minutes now. And there's a lot of trainings, a lot of group supports, a lot of, I think one of the things Gerard mentions, I think bring me to one point that when you do open dialogue sessions, you're actually telling each other what you're facing, you're not alone. There are many of us probably also facing the same challenge, and being able to openly share those stories and trouble, it's helpful to know that. And going back to the questions that I was going to ask you, Oliver, in terms of training, when people go on to training, it's just 1 hour, 90-minute sessions. Like people often ask, I'm sorry, I put you on this spot because I probably haven't run this through with you, but people often ask, oh, I have these questions I found, I mean, YouTube, you know, I have training I can just view online. What's the difference? Why do I have to attend trainings? Like, what is there anything that you can share when people actually attending training as physical sessions running?
Yeah, I mean, it's really, so the added benefit of when you're attending a session as a group is that you can make the content, you can take the content for just what's being presented to then be conversational about everyone's experiences and goals as well. You can learn from each other's experiences in practical application of the content as well. So we've just learned about some signs of low mood, but then the discussion that can come off that about what people might have seen in their communities or in their business units, etc., can really help to really embed that learning, because we learn even better through conversations and through stories, right? When we can associate that content with a real lived experience of mine or a lived experience that I can understand of someone else as well. So it's always beneficial to have that group learning, because you get those other vicarious learning opportunities that present outside of just clicking through an e-learning program or individual process as well. So that's really important as well. I always advocate for group learning sessions as well as then independent learning through just based on the content as well. I think also as well is it's really good to do repeated learning as well. So session one, you know, learn some skills, have some conversations, allow opportunity then for people to then observe and interact with those behaviors out there in the workplace, out there at the front line, and then come back together and share experiences. What additional, in a more facilitated conversational capacity, where we're just discussing what we've each experienced and what learnings we've created, so that my experiences don't just stay with me, but I share them with my colleagues, and we create a quasi knowledge management system where that becomes a resource and experience for everyone as well. The only other thing I'd add to what Dr. Ung said as well was, you know, if organizations really want to advocate for good mental health culture and their people being able to identify and support their people through mental health crisis situations, build the capacity for your managers to be having conversations with people. Often what we see with organizations, they do this terrific training, they build it into their values that we're going to prioritize well-being. But as soon as the reality of the world or the busyness of the world takes over, those one-on-one conversations, those one-on-one informal feedback sessions from manager to employee, you know, they get cancelled, they get rescheduled, and then there's less opportunity to have a conversation, which is when you're going to recognize maybe some things are coming up for this person. Yes, you might observe some things from a distance, but it's not until you have a conversation with someone that you might really start to understand and get to know their story, and that they might be struggling, and be able to then link them to those supports that are in place within your organization.
Thank you, Oliver. So we got some poll question for you again. So please choose the answer you see on your screen. Where is your organization in the development of an employee assistance program? A, we are aware but haven't taken actions. B, we are developing a well-being strategy that includes an EAP. C, we have a strategy and we have implemented an EAP. So I understand that EAP program is something that's come up in advisory. Implementing employee assistance program, it can be new. Some of them might be quite well known about that already. A lot of you will be implementing it at this moment, but you are wondering what does it come after? You know, what does it conceive in EAP program? What can EAP do? That will probably, we do not have enough time to go over all into the details, but that might be some of the questions that we have. But most importantly, when we actually implementing this, which is we can see in the poll result that a lot of you have selected that you do have a strategy and you're implementing the EAP program. But I'm pretty sure a lot of you will have these questions that's coming up. So how do we actually measure the effectiveness? When we doing EAP or well-being program, implementing all these initiatives, you as organizations, we no doubt we will ask this question. We want to know the effectiveness. So Dr. Ng, could you give some pointers on how we can measure the effectiveness?
Yeah, thanks, Joanne. I think this is the million-dollar question that many of us in mental health and in public health, we are looking for the answer. How do you measure the effectiveness of a well-being program? Because a lot of times a lot of the things that's being measured, for example, participation rate, number of people in a company that uses a certain service, are really just measuring outputs. We are not really measuring the outcome. To me, as a psychiatrist, as a clinician, a good outcome with better mental health, better happiness score, whatever that form may be. But we have to start somewhere. I think companies need to look at data, as with many other things in life. We could conduct regular surveys and questionnaire looking at mental health, job satisfaction, overall well-being. We could look at things like absenteeism, rate of MC. I used to think that MC is a measure of morale rather than a measure of health. Yeah, that may be true in some extent. Certainly, companies can also look at productivity metrics. I think in the past, when I was head of department, I would look at the number of patients that a certain doctor would see. And then if there's a deviation, I would check in with the doctor to ask, actually, is everything okay? We used to also look at things at MC rates as well, and things like that. Sometimes I think there is room for what we call qualitative data. Companies can either do it or they can sort of commission another group to run focus group discussion, interviewing employees about their own experience. So it's more qualitative about whether anything in the company has changed with regards to well-being programs in the company. We know that there is a very, very close association between mental health and physical health. So sometimes we can even use biometric assessment or health screening results to look at the overall health. Blood pressure, for example, we know that it goes up when it's stressful. We can even look at BMI. We know that obesity is also associated with increased stress. And we can look at number of visits to health professionals, mental health professionals. Interestingly, we find that in some situation, seeing a doctor for things like lower back pain, seeing things like headaches, all these are actually quite good metrics for the mental health of the company. So these are some things which companies can then discuss with their health providers to look at the health data, not so much to penalize the workers, but really to look at whether there's any changes in the trend that could indicate that there is some ongoing stress within certain departments, within certain groups of employees.
Thank you, Gerard. Thank you. No, of course, I mean, your body definitely reacts to things that you don't know. Like if you're stressed, you don't think you're stressed, but your hand is shaking, definitely you're definitely nervous. Is something that I'm experiencing right now. So Oliver, do you have, like, in terms of EAP, do you have any suggestions, any benefits that you can share around this area?
Yeah, so I mean, the good news is that 67% of the organisations represented in the participants of this webinar are already receiving reports. So a good EAP provider will be providing back that de-identified group statistics, which should be tracking certain measures like what your presenting issues are, types of interventions provided, and some outcome rating scales as well. So the impactfulness of or effectiveness of your organisation should be seen in some of that data as well. I always encourage then organisations to also track, when they set out and input these programs and when they develop their wellbeing architecture, what outcomes are they hoping for when the rubber hits the road within their organisation? Is it a reduction in accidents? Is it a decrease in safety violations? Is it an increase in productivity? Whatever it might be. So make sure you're cross-referencing that against your EAP data and utilisation as well. I think also it's important then that you reference your engagement scores as well with the organisation as well. So utilisation will only talk to those that are presented to sessions or interventions by your EAP, but engagement data should show, amount of people that have accessed to different data points or resources or attended trainings or different workplace engagements or events that you've hosted through the program as well. I think that can be some really insightful data as well. But as I mentioned before, I would also encourage organisations to reference against, what outcomes are you hoping to see as a result of these programs external to the EAP, whether that be, profitability, reduction in absenteeism, reduction in presenteeism, reduction in mistakes, accidents, whatever it might be, and see how that's tracking against your utilisation and engagement data from your EAP as well.
Thank you, Oliver. We definitely agree. I mean, with all these sharings and good pointers, effectiveness doesn't just come tomorrow. It will take a long time to measure it. It's a period of time and a consistency to do so. As you all know, mental health is important. Actually, close to half of the Singaporean place mental health as the biggest health problem facing the country today. And stress is actually a number 3. 55% reported feeling stressed enough that it impacts their daily life. Like we mentioned earlier, your daily life include your personal life that impact your work, will impact your personal life as well. 49% of them reported feeling depressed, sad, hopeless on a daily basis. And over 1/3 of the people reported that they have considered suicide or self-harm at least once in the past year. So as we know, daily life, like I mentioned earlier, include work. And we spend large amount of time with people at work. Dr. Ng, I know we have repeated the trainings and ambassador programs, a lot of initiatives that are actually listed in the advisory that will help. But we're talking about leaderships and manager, but of course, including the peer around it. How could actually everyone in the workspace recognize and respond to the declining mental health symptoms of others or ourselves?
So I think for this, there is really a need to know, to be educated on recognizing the signs and symptoms of common mental health issue. We are not training employees or managers or leadership to be psychiatrists or doctors. We are just hoping to be able to teach them to recognize certain deviation from normal behaviors. And actually, the only way you can notice that there is worsening of behaviors or changes in behavior is that you need to know whoever you're working with in the first place. If you don't know your colleague, if you don't know your neighbor, you will never be able to detect that there's a change. So for example, if you notice that one of your colleague, we call this behavior changes, right? If you notice that they're not coming to work, they're not answering to your emails or messages, you find that they become more irritable in their interaction with you. They stop going out with you for dinners, for coffee, just basically not engaged. They may be very irritable or have mood swings at work. Then you might want to use these observations and gently prompt to check whether anything is going on in the person's life. You can use, for example, this is really about practicing active listening, right? And this comes with training. Just ask, oh, I noticed that you have this. Is there anything going on? Is there anything I can help with? And I think this is crucial. For individuals themselves, perhaps if they notice that they are more tired, they are getting sick more easily, they really feel very hopeless, they start to have very visible signs of anxiety, like having panic attacks, difficulty focusing on their tasks, difficulty remembering certain information, then I think this could be symptoms that may warrant further evaluation, whether by EAP or by a GP or even by a psychiatrist. So these are different things. It doesn't come naturally, but a workshop or skill building kind of workshop can also help to go a long way in helping companies, workers detect whether there's any mental health symptoms. And how to respond then, it really depends. I think we spoke a lot about having supportive environment, having very appropriate conversations at work, having EAP programs, mental health hotline, counseling services, linkage to GPs, and linkage to psychiatrists. I think all are different resources that during the training, then we might be able to educate the company about, okay, this equals to need to see EAP, this equals to probably need to escalate to a doctor, this one needs to call the police because I think there's a great risk of suicide. So there's different action items based on the risk and needs level. So this can all be sort of resolved through ongoing workshops, ongoing training and awareness for the company.
Thank you, Dr. Yes, and I think one of the very important you have shared is we're not, all these training and educations, we are not trying to educate them and become a psychologist or counselor in the workplace. And just to spot slightly difference from the norm, those are some of the pointers that we will be doing, and it could be a good initiative to implement. We have a question from the audience. The question is, with regards to culture and advocacy for mental health at workplace, how do we navigate around manager who says the right thing at the right forum, etc., but do not practice authenticity with their direct reports? Oliver, would you help to answer these questions?
Yeah. My first question back or sort of thing that I'd comment on is just probably trying to understand whether the manager believes that they are being authentic. So maybe they themselves think they are being open and honest or authentic with their direct reports, but it's just lost in translation for them. Maybe it's just that, you know, they've got really good intentions set out and they're just not quite nailing the delivery of that sort of behavior or that speech. It could just be an awareness factor for them. Maybe they do truly believe that they want to support the well-being, but, you know, the way they operate their lives is they do send emails at 10 p.m. at night. They're not expecting people to reply to them, but they're going to do that because that's what works within their pattern of behavior and lifestyle. So maybe potentially having a bit of a chat with the manager first, just, you know, an informal, non-intimidating, just, hey, just wanted to reflect back that you're saying a lot of the right things, but we're seeing a couple of these other behaviors which are maybe contradicting to what you're saying, like the emails at 10 p.m. or whatever it might be, and see how that floats with them. They might appreciate the feedback and go, oh, I didn't recognize that, or it might unearth a deeper conversation with that manager around what their perception of mental well-being in the workplace truly is, and what they might need to be working on. I think then secondly would be probably again trying to reiterate to them the importance of, so if it isn't just a misalignment or a non-awareness about how their behaviors are impacting their people, and it is maybe a lack of true authenticity in their approach, I think then probably you're needing to re-articulate to them that, you know, well-being is something that the organisation takes seriously, and as a manager at the organisation, there is an expectation that they are advocating for well-being amongst their people, and that they are fulfilling those sorts of advocacy and responsibilities. And secondly, probably again providing some perspective of them around that executive blind spot. I know managers aren't executives, but managers would also have blind spots around that. The way you might be operating, the way you might be perceiving certain things is not the way that your other people might be perceiving or experiencing their lives as well. They might have things that you're not aware of, or maybe they've got different challenges or duties which are different to yours. So trying to again create that awareness for them that we're all humans operating in different perspectives, and we're going to have different things that we need to be challenging on, and that should hopefully bring them into alignment. And again, offering some further training if that's what they need as well, if they feel like they're unequipped, ill-equipped to be authentic in that as well. But probably on that note as well is making sure that you then invite them to provide their perspectives of what they might need to be more authentic in their communications and behavior with people. Do they need more competence, confidence, or capacity? So confidence in what they're doing with these conversations, competence in mental health literacy, or capacity, you know, job design to ensure that they're able to support their people authentically as well.
Thank you, Oliver. We have another question from audience, and Dr. Ng, I will address these questions to you. So the question is, how do we balance mental health priority of employee versus setting expectations of work? As once they say they are under mental stress, usually managers back up.
Okay, so I think this is really quite difficult because I'm on the clinical end, right? And I've been asked to write memos to companies, and then I hear one side of the story. I hear what the employee tells me about what the company is demanding of him or her. I've also seen, I must also state up front that I've seen cases where employees come to me and they make certain requests which makes me wonder whether there is any agenda when they came to see me. I think I want to be upfront and say that that's the case. And when we see patients, we always bear this in mind. Not that we doubt our patient, but we're always wondering what is the expectations. I think as a manager, when your employee tells you that they have a mental health issue, I think it's always good to give them the benefit of the doubt, and then maybe use that as a launchpad or an opportunity to find out more and whether the company can help in any way, rather than to doubt them in the first place, or are they trying to, the military term is malinger, right? The legal term. Give them the benefit of the doubt first and then see whether the situation changed. I think it's reasonable to sort of understand a little bit more about what's driving the mental health distress. Is it a work-related problem? Because if it is a work-related problem, then there is a little bit more space for the company to do something about it. Maybe it is a supervisor that is not sympathetic. Maybe it is a supervisor that practices favoritism. Maybe it is an employee who has been abusive. So work-wise, then can do something about it. If there is a non-work problem, maybe it is an interpersonal issue, maybe it's a family issue, then with greater awareness and training, then the supervisor, the manager can make certain recommendation. Okay, maybe see the EAP for help, maybe you can go and see a doctor, and then you can do some intervention. And then you assess again after a while. Do regular check-in with the person to see whether the situation is improving. Certainly, this needs to be two-way. If the employee does not want to say anything and just want to get long MC or just want to say that I have mental health, please leave me alone, don't give me more work, then I think that also says quite a bit. I want to assure people listening here that as a clinician, I always try my best to get corroborative information from the supervisor and manager as well, but I will need consent. If the patient in front of me does not want me to does not want to give me consent to speak to the company, then unfortunately I can't. But I would try again. Every visit I'll try to get some information and see, and then to see whether the person is allowed, and everything is geared towards helping the individual. And if that is the company's intention and they're genuine about it, then I think it'll be okay. This is my view. I don't know whether Oliver has any views about this.
No, I think that's exactly spot on, and I think the best thing you said there as well was, use that as an opportunity to open up and open that conversation with the employee to see, if there is anything the organisation can do. We can offer you the employee assistance program if that helps you. Try to solution focus with the individual how we can move forward from this point. What can we do to help you thrive here and help you sort of achieve your goals and duties here at the organisation, as well as addressing these challenges as well. So we've got the EAP program. What can I do as your manager? Do I need to, make some momentary considerations, maybe providing a barrier between you and the individual that you're having some interpersonal issues or challenges with at the moment? What can I do within reason to help try and make the environment more conducive to you being successful? And that'll help you uncover whether or not the person's kind of like they're being authentic in their articulation to you, or whether maybe they are coming with a slight agenda or trying to dip and dodge some duties that you can then do. And you can help create an environment of success there through that as well, by just taking the time to have the conversation. Is my role now as the AM manager to advocate for the support programs that we have? Maybe it's something external for work. You've got the EAP program. What can I as a manager do to help control the environment a little bit in this moment to help you through this challenge? And then we get back on track and we move forward from there.
Thank you so much, both. And we have come to the end of our sessions. And I would like to thank Dr. Ng and Oliver for participating today and for sharing their insights with us. I would also like to thank our audience for attending. You will receive a survey at the end of this webinar where you can add your comments, and please feel free to share either about what you heard today or any topics that you would like to see covered in the future webinar. If you would like to receive more information, please contact us at service@workplaceoptions.com or visit our website at www.workplaceoptions.com. Once again, thank you all for participating, and let's work together to prioritize mental health and well-being in our workplace and ensure that everyone feels valued and supported. Goodbye for now.